You are so nervous because you can't wait to know if you're pregnant. And you've been told that you have to wait about 2 weeks after ovulation to make pregnancy test, but you want to know as soon as possible. And you wonder, is there any chance for you to find out earlier than that? Well, if what I've just said is about you, keep watching this video because I have a very detailed answer to that question. After the ovulation, when egg is released from the ovary, it goes to the fallopian tube where it's going to be fertilized by the sperm. Fertilized egg starts to divide, and while dividing, it's traveling down the fallopian tube to the uterus cavity. Fertilized egg will divide into the blastocyst. Blastocyst is kind of a ball of cells which contains inner and outer group of cells. Inner group of cells is called embryoblast. Embryo will develop from these cells. And outer group of cells is called trophoblast. Trophoblast is a group of cells which is nourishing the embryo and is going to be a part of the placenta in the future. Blastocyst attaches to the uterine wall and invade into the endometrium. This process is called implantation. After implantation, trophoblast starts to produce HCG. HCG is a human chorionic gonadotropin. It's a hormone which your body produces during the pregnancy, and HCG turns your home pregnancy test positive. Implantation can happen as early as 6 days and as late as 12 days after ovulation. But of course, you shouldn't expect your home pregnancy test will be positive just the same day as implantation happened, because HCG needs some time to increase. And that's why we usually recommend make pregnancy test when you have your missed period, because by that time you will have a good amount of HCG in your urine and your home pregnancy test results will be more reliable. There are some early detection pregnancy tests which can detect pregnancy 6 days before your missed period. But not all pregnancies could be detected that early, because HCG level is different in every pregnancy. Someone will have a good amount of a hormone before missed period, which could be detected by the home pregnancy test, and someone will have a lower amount of HCG. In early pregnancy, HCG grows fast. It doubles every 48 hours. If you have negative test results before missed period, but you think you might be pregnant, just repeat test in a couple of days. For more information on pregnancy testing, you might watch my previous video. After implantation, not only HCG starts to increase, but also progesterone level is growing, and that's when you might start to have some early pregnancy signs. And now let's find out what are the most common early signs of pregnancy that you might start to feel even before your missed period. Early in pregnancy, hormonal changes might make your breasts sensitive and sore. Your breasts may become swollen and bigger in size, and the area around the nipples may become darker. The next one is morning sickness, which is nausea with or without vomiting. Morning sickness actually can occur at any time of the day. When you're pregnant, you might become more sensitive to some smells. Your sense of taste might change. You might start to like food that you never like, or vice versa, start to hate food that you always like. Another signs of pregnancy could be bowel changes, which might be bloating or constipation. The amount of blood in your body increases during pregnancy, and that's making your kidneys work harder. That's why you might experience increased urination. And the other reason for that is that your uterus, which is growing, which is getting bigger in size, starts to put some pressure on your bladder. And because of that pressure, there's less space left for the urine. Because of pregnancy-related hormonal changes, your mood can change really quickly. Like you might feel very happy, but in a minute you become angry or anxious. Other signs of pregnancy might be light spotting, known as implantation bleeding. Usually it's a few drops of blood, which is light pink or brown color. It lasts from a couple of hours to a couple of days, and might occur from 6 to 12 days after ovulation. You might get cramps in your belly because your uterus starts to grow and your ligaments are stretching as your womb grows. Also, as I said before, you might have constipation or be a little gassy. Also, sometimes implantation can cause you mild cramps. Bleeding and cramping may be a sign of ectopic pregnancy or miscarriage, and other symptoms may be a sign of some diseases. So, if you have any of them, you better contact your doctor and not to self-diagnose. I would appreciate if you share your experience in the comments down below, whether you had or you didn't have any early pregnancy signs. Thank you for watching. I hope this video was helpful for you, and I hope to see you soon in my next one. Bye!